like to thank the organizing and scientific committee for their tireless work in assembling this conference. I will let you know that Dr. Ngugi, Rosie Ngugi, and Eric Njenga, and I'm not seeing her here, Eric Njenga and Irene Njenga, they did a marvelous job, and they helped us in every way. And I thank the various commercial company for coming forward to support this conference. And I want to thank those who submitted abstracts for this conference. And I want to request you also to submit abstracts so that when you go to Livingstone, you don't just go for touring, but you shake that nation by making presentations. And I want to see all of you, including the Baga, Zaid Baga, Hussein Baga in Washington, and all of you, yes, in Zambia. Welcome to an exciting journey into the future of medicine.
Mind just to say thank you, everyone, for making time to travel all the way to come to Mombasa. I want to thank all the subspecialties who've been very, very cooperative when we were starting out this journey on making the program. All the heads, Kenya Cardiac, Kenya Diabetes Study Group, RESOC, KRA, they have all been Kesho. They were all very, very influential in actually just providing us with the topics, making our work much easier, and also nominating the speakers. And they've also given us excellent talk in line with our theme for today. So I think even it's good to see a lot of young physicians in the room. So mine also is to urge the younger physicians play an active role in the society, and would like to see more of you also, coming up to say, I want to take part in leadership. I want to vie for this particular post. I want to be a treasurer, assistant treasurer in the future, because we need to build the society. We are a very good, large cohort of younger clinicians now, and we'd like to see them actively participate in society matters, whether at branch level or at national level. We're also happy to see them taking part in the program, and I'm also happy to see several abstracts here by our residents and also our clinicians. And thanks, Dr. Bundi Karao, for also, he's going to be leading that particular session. We also want to thank Olive, who's also driven our EXACOP agenda. As you're aware, we graduated our first cohort in August, and she's done a good job of steering that particular society in terms of helping us with all our accreditations, re-accreditations, exam coordination. They've worked with Professor Joy, who was the former president, EXACOP Regional. So thank you so much, Prof, for that milestone that we're able to see and achieve here in Mombasa. So we are truly grateful. So with that, I thank also the farmer, like we said, for helping us have this conference take part. Without them, it would not be possible. So I urge you, please visit their booths, sign their books so that they can also see and feel the value of having all these doctors present here today.
Detecting early disease outbreak, again analyzing previous existing data, and signaling any threat. But more important, slowly AI is going to make infectious diseases especially redundant, because you need them. AI can predict diseases, can select antibiotic treatment. AI will give you report or sensitive report of organisms well before the laboratory report is out by predicting. Control measure, it gives you the best antibiotic regime, dosage, duration, and route of administration. So you don't have, is it worth giving you the IV or IV, but above all, it will tell you that determine whether this guy is going to be resistant to this antibiotic or not. So it's incredible what he can do. And even now, in public health or in community healthcare, AI chatbots. Now, how many of you have got AI chatbot in your phones? Hands up. I can't believe it. If an old man like me can have If a museum like me have a AI chatbot in my phone, okay, you pay $99 only in a year if you want it active, but you can have a free 1 month free trial, which is better than nothing. Okay, how many of you have got Meta AI on your phone? That is for free.
Just an African problem. As a matter of fact, an assessment that was done in last year, 2025, estimated that by the year 2030, globally, the global healthcare worker gap will be 10.2 million health workers are required. And yet we're talking about personalized healthcare, which postulates that one size does not fit all. At the same time, we're saying that our medical costs are expected to rise by 10% every year. This was assessed last year. And therefore, it's not a surprise that tools to help us become more efficient, to do more with less, become very important. And this is existential. We have no option. Let's quickly jump to digital and AI. What is quite interesting, and this is because I come from a corporate background, is that
we are truly honored to also have distinguished speakers from the different subspecialties in medicine, be it diabetes, be it cardiac, be it renal medicine, be it oncology, and we have excellent talks. It's a 3-day event, and we started off with excellent workshops. We had the point-of-care ultrasound workshops, training our doctors on how to use point-of-care ultrasound to diagnose conditions and how to save lives. And also we had the renal vascular access workshops to try and train our doctors how to have access in the setting of patients who require dialysis and who have fistulas.
So I represent the Xplode program, so I coordinate that. And one of the core mandates of the Kenya Association of Physicians really is training. So at this conference, one highlight will be the interaction between our trainees, those are the physicians in training, as well as the very senior physicians, as you've seen them speaking since morning. So in addition to the networking, there's a lot of mentorship in terms of research work, in terms of current practice, in terms of even the use of AI, particularly in the current landscape of medical practice. So we are very proud as an association to have been able to onboard the postgraduate training. We are one of 7 countries that offer it across Africa. So a real highlight and truly a great moment for both our trainees as well as the senior physicians in their interaction during this conference.
So we are very proud to meet here as physicians from different parts of the country. In Kenya, most of the physicians are normally centered around Nairobi, and you find that some counties are really undeserved. However, now we are going to discuss how AI is going to improve in terms of communication with physicians who are very distant, who are in very far counties. AI is helping us be able to communicate with other physicians across the far-flung counties. We are also able to use AI to diagnose our patients and also in follow-up of patients. And AI is also helping us determine outcomes of patients. In regards to diagnostic techniques, we have radiology techniques that enable us to communicate with physicians from far-off counties as well as far-off countries.
Once they finish training, placement in various facilities in their counties to be able to provide service. So that's the collaboration that we want to have with the government. In fact, this is a mandate from the East and Central Africa ministers, which is called the EXA Declaration, which was made several years back to try and commit to training of healthcare practitioners to serve the region, especially in the low-resource settings. Yes, of course, AI has its challenges, as you're all aware, and definitely there's regulation, even in the Kenya Medical Dentist Practitioners Council. There are now laws that have been enacted into how AI is used and governed, especially in the issue of data protection. When you're looking at patient data, AI is being used to collect research data. How do you protect this data? How is it stored? For how long should it be stored? So all these are the actually government acts from the ICT Commission. So we are using AI extensively. It has its good and bad, and of course we also have to ensure that the information that is provided by AI is accurate, because it's highly accessible to all our patients. So there's also ways in which to ensure that we provide the correct platforms where they can access this information in an accurate manner, and it's a reliable source which can be backed up by clinical evidence.